It's a CMS from neurology. Mm, As I'm studying neurology these days, actually not studying neurology. Actually, I'm studying biostat these days, but I like to swap. I like to switch on multiple subjects, as because mm staying on the same subjects for long makes me bored, and sometimes switching a new subject makes me happy, as well as makes me comfort for dealing with lots of questions. Nowadays I feel sleepy all the time. I don't know why that is the reason. Maybe I feel so, maybe I'm not emotionally well, that's why I feel so tired all the time, day and long. Okay, enough talking now. Now I would like to go through a CMS form. I don't know how you will enjoy it or not, but I try to solve the question with you guys. Okay, a 77-year-old woman with mild dementia, Alzheimer type, is brought to the ED by her daughter 3 hours after the sudden 3 hours after the sudden onset fearfulness and combativeness. The patient lives with her daughter and son-in-law. She attempted to smash their television screen with her walker and struck her son-in-law when she tried to stop her. When he tried to stop her, so she becomes aggressive when somebody tries to stop her. She has hypertension, GRD, tuberculosis. Her medications are metoprolol, omeprazole, trimethoprim, hydrochloride, and donepezil. On arrival, she is hostile. On arrival, she is hostile and accuses the physician of trying to steal her money. Her temperature is normal, pulse normal, respiration 16 per minute, blood pressure 144/82. Physical examination show restless movements. Mental status examination initially shows hypervigilance. The patient later appears drowsy. She mutters She mutters under her breath as if he is responding to as if he is responding to internal stimuli, and picks picks at the ear. Her mini mental status again 10 out of 30, so very low. Which of the following is a diagnostic study? Are most likely to be abnormal in this patient? Liver function test, serum vitamin B12, serum toxicology screen, thyroid function, and urinals. Yeah, this is a kind of acute delirium state. Young female, restless, hypervigilance. 3 hours after sudden onset, fearfulness and combativeness. Looks like we should do the urine analysis because UTI is the number one cause of delirium. Okay, a 77-year-old woman is brought to the physician by her son because she recently has become unable to take care of herself. So she's unable to take care of herself or walk independently. Her son says that her ability to function has declined. During the past 4 months, she has not had any specific complaints. She has hypertension treated with atenolol and enalapril. Her only other medication is 81 milligram aspirin 6 hours 6 years ago, she had myocardial infarction. On examination, her speech is confused. Her blood pressure, her blood pressure is 72 per minute. Sorry, her blood pressure, her pulse is 72, blood pressure 145 by 86. Examination showed diffuse muscle weakness. Examination shows diffuse muscle weakness. Gait testing shows an inability to ambulate. Gait testing shows an inability to ambulate. She can recall one of the three objects after 2 minutes. Results of the lab studies are within the reference range. An MRI of the brain shows multiple small infarctions throughout both cortices and a few in the thalamus. In addition to adjustment to antihypertensive medication, administration of which of the following is the most appropriate management. Examination shows if muscle weakness. Gait testing shows inability to ambulate. Gait testing shows inability to ambulate. She can okay. Next, a 62-year-old man is brought to the emergency department 3 hours after the onset of double vision, 3 hours after the onset of double vision, and left eye, and 3 hours after the double vision and left eye pain that she first noted when she awake. She first noted when she awake. When she awoke, she describes a horizontal separation of the images, which is worse for distant as opposed to the near vision. She has 18-year old. She has an 18-year history of type 2 diabetes mellitus. Examination of the left eye. No examination of the left eye shows mild adduction of the primary gaze with severe weakness of abduction with conjugate gaze to the left. The remainder of the neurological examination left mild adduction and primary gaze with severe weakness of the abduction. Uh, left eye shows. Examination shows left eyes with mild adduction on primary gaze and with severe weakness on the abduction. I think it's sixth cranial nerve, where lateral rectus actually occurs.